Hi, welcome. In today's video, we shall be talking about typhoid fever. Why is typhoid fever a very important topic? Worldwide, about 22 million people get infected with typhoid fever every year, and about 200,000 of those die of the disease every year. Typhoid fever is a problem that affects a lot of countries over the world. In the continent of Asia, in countries like India, China, Vietnam, Indonesia, Pakistan, among others. In Latin America, in countries like Chile. In Africa, countries like Uganda, Ghana, among other countries. In the Caribbean region, countries like Jamaica, Haiti, Trinidad. Countries in the Oceania region like Australia, including Western Europe and America. It's a problem that affects almost all countries in the world. Typhoid fever is caused by a bacterium, a family of bacteria or a group of bacteria known as Salmonella enterica. There are two subspecies, that is the typhi and then the paratyphi type, that cause this disease called typhoid fever. We normally acquire this bacteria when we eat food that is contaminated with this bacteria, or if we drink beverages or water or anything else that is contaminated with this bacteria. Someone might be asking out there, how then does this food or these drinks get contaminated with the Salmonella bacteria? We have people who are carriers of Salmonella enterica, meaning they have this bacteria in their system, but they do not fall sick. However, they have the capacity to shed this bacteria and spread it to others. The spread of typhoid fever is not any different, or not so much different from the spread of other diseases, like peptic ulcer disease. In this case, we're talking about H. pylori or cholera and things like that. For that reason, I'm not going to talk about the spread or how the contamination happens in detail. But at the end of this video, I'm going to provide a link because I explored this topic in detail when I was talking about the spread of H. pylori. Particularly, we are talking about the fecal-oral transmission. I think at the end of this video, you'll click that link and go ahead and watch that video so that you understand in detail how this bacterium spreads, how it gets into food, how people who are sick or carriers spread it, and how it is spread by houseflies and by poor hygiene and things like that. And likewise, in that video, you'll also find talks about the prevention of typhoid fever. That being said, let's go straight to discuss the signs and symptoms of typhoid fever. Now, normally from the time of infection of with the bacterium to the time of onset of symptoms, it usually takes 1 to 2 weeks before you get sick. So you will not ingest the bacterium today and tomorrow you're sick. No, it takes some time multiplying and growing. It's called the incubation period of about 1 to 2 weeks. After the incubation period has elapsed, normally the first symptoms to appear are symptoms pertaining to the abdomen or your digestive system. So you might experience abdominal pain, generally a diffuse abdominal pain, or sometimes you might experience the pain which is localized on the right upper side of your abdomen where the liver is normally found. Some people might experience constipation, which is medically defined as having a bowel movement less than 3 times in a week, or having passing out hard stool. On the other hand, some people actually experience loose stool, or some people call it diarrhea, but I think it's more appropriate to call it loose stool. So those are the symptoms that tend to pop up in the first week of symptoms. And then during the second week, people usually tend to start to experience fever, and this fever keeps, it comes in the morning, gets a little bit, worsens throughout the day, and then you go to sleep. In the morning, you wake up a little bit better, and then the next morning it keeps rising. But every day the fever keeps getting worse and worse and worse. It's described as a step ladder fever. If it still goes untreated, the disease goes on and on. Some people may end up experiencing, having cough, and then you might experience a frontal kind of headache, which affects, only the front part of your head. It's usually a dull headache, not so much headache. And then still, if it goes untreated, the symptoms progress. If it goes on to the third week, now you get so toxic, you become weak, you lose appetite, you start losing weight, you get so sick. And then it could actually get to a state where you start getting confused, you're stuporous, your mind is not working properly, you might have psychotic features or hallucinations and things like that. That's actually where the disease gets its name from, because the word typhoid translates loosely to a cloud or to smoke. So sort of your mind is cloudy, it's not working properly. So usually those are the last stages of the disease. You reach those stages in about 3 weeks or so. Also around that time, remember the bacterium goes in through your gut, and from the gut, it uses the cells of your immune system to enter your blood, and then uses those same cells as a vehicle or as a means of transport to move all around your body. The first place it usually goes to is the liver. They multiply from the liver, and then from there it could actually spread to other parts, the bone marrow, the spleen, and to a lot of other organs. But normally the organs we worry about, especially the heart. It tends to affect the heart so much. And a number of patients actually who die from typhoid fever actually die from inflammation of the heart. Others could die from excessive inflammation of the gut, which leads to perforation, which is basically a formation of a hole in your gut, and then the contents of your gut spill into your abdomen and cause a very terrible situation inside there. But it's not like everyone who suffers from typhoid fever ends up dying. Like I quoted, about 22 million suffer, only 200,000 die. Some people might actually survive even untreated, okay? Even untreated, some people survive. And when they survive, they may either, the immune system might overcome the bacteria completely, and then the bacterium is cleared completely from their body, or, they reach a state where they start to live together. The bacteria are there not causing any serious symptoms, but then the person is not feeling sick. So those are the people who become carriers. And then normally those are the ones who continue, spreading this bacteria to other people, maybe when they handle your food or your drinks or things like that. It's also very important to note that not everyone experiences that classical type of presentation of typhoid fever. Some people might actually experience one out of all of those symptoms. Some people come with only headache, and it's the only thing they have. Some come with only, fever. Some will come with that abdominal pain. Some don't have, any of the gut symptoms at all. So people are different. Some get constipation, like I noted earlier, whereas others get diarrhea. So there is that variation, okay? There are those even that present in a weird way, because typhoid tends to mimic also other conditions. It can present like osteomyelitis, which basically means an infection of the bone, okay? It could present like an abscess, which also means formation of pus in any area of your body. It could also come with the same symptoms like pneumonia. Okay, we already talked about cough earlier on, but it can actually come as a full-blown pneumonia. It can also present like a UTI. You think you have a UTI, but it's actually typhoid fever. You might get yellowing of the eyes and things like that. So it raises a very important point here, because it takes a trained mind to recognize what typhoid fever is. So if you happen to experience any of these symptoms, it's important, very, very important, that you do not diagnose yourself at home and attempt to treat at home, because you might be on the right track, but you could also misdiagnose, because there are a lot of other conditions that resemble typhoid fever in a lot of ways. So once you have the symptoms and you suspect that you have typhoid fever, it's very important that you reach out to a trained healthcare provider that is going to listen to your story, examine you, and probably do a test or two, and then prescribe appropriate treatment for you so that you recover in a good way. Maybe someone might also be asking, what kind of tests are available for typhoid fever? Generally, typhoid fever is a difficult one to diagnose because many of the tests that are available, especially in low-income countries like Uganda, do not have that very high sensitivity and accuracy. And those that are accurate or sensitive are very invasive. So, for example, I wouldn't want to dig into your bone marrow, because getting a sample from your bone marrow would be very sensitive, but I wouldn't want to dig into your bone marrow just to diagnose typhoid fever. So generally, clinicians like myself tend to diagnose this condition clinically, which means by listening to the narrative that the patient tells me and examining, I could suspect and probably conclude that there is a very high chance that you have typhoid fever. Most of the time, that's enough to diagnose typhoid fever accurately. The other tests, we basically use them to support the diagnosis or to rule out other diagnoses, but the tests are not like, it's not like we base on tests entirely to diagnose you with typhoid fever, because I can do the test, it turns out negative, but if I still highly suspect that you have typhoid fever, I still end up treating typhoid fever. The treatment of typhoid fever could be in the outpatient department, which basically means we give you medication, you go home and take it at home. That is if it's not very severe, or if the illness is serious, we could end up admitting you in a hospital and give you drugs through the vein. In terms of prevention, like I mentioned, it's also covered in the video where I talk about the spread and prevention of H. pylori. It's not so much different, only that in that video you'll go ahead and focus on only the fecal-oral transmission, and then you'll skip over the oral transmission, because the oral transmission only applies to H. pylori. But from where I start talking about the fecal-oral transmission onwards, it also applies entirely to typhoid fever. Otherwise, thank you so much for watching. In case you still have any more questions about typhoid fever, feel free to drop them down in the comment box, or check for our email in the description of this video, and then you can send us a message and we shall do our best to respond in time. In case you have any other additions, if you think I've left out a few things, also feel free to do the same, drop them in the comment box. And if there is a topic that you think we should cover next, please let us know so that we cover it for you. But thank you so much. Don't forget to like the video if you enjoyed it, and subscribe to the channel. Click that link on your screen bearing the logo of Medicoria to subscribe, or watch the next video which is going to be displayed on your screen. Thank you so much, and see you next time.